It's an incredible honor. I'm filled with so much pride when I think about this hospital and the legacy that this hospital has in Buffalo. I'm a Buffalo boy, born and bred. I was actually born at Suburban, so I was born as part of the Clyda family many, many years ago. And honestly, I feel like the legacy now is really how are we going to improve the health of the children of Western New York, well beyond the four walls of this hospital. And it's things like this telethon that really help us to do some amazing things for our community. The great thing is every day is different. So, there's no predictability. I usually get here between 7 and 8, and I usually leave between 5 and 6, sometimes a little bit later. I see patients sometimes, spend time on the weekend seeing patients. I'm developing programs, recruiting people, interacting with staff and solving problems, working with the university and helping to develop research programs. So really the exciting thing is I get to have my hand in so many things, but at the end of the day, our core mission is to improve the health of the children of Western New York. And we know with having such a high poverty rate for children, one of the highest in the nation, we have a significant opportunity here. And so we hope that with our partnership with great donors and support from the community like you and all of our community-based organizations, we can come together with one voice and really elevate the health and wellness of our kids. So, we offer a full spectrum of all pediatric medical and surgical subspecialties. So if your child has any need, we're able to meet it. Many of these subspecialties aren't in every community. Things like pediatric neurosurgery, pediatric rehabilitation, and physical medicine. We were able to recruit a brand new young physician there, which will be working in Robert Warner. I'm very excited to have her, Dr. Diana Marchese. And then the typical things like pulmonary and GI and allergy, immunology, genetics. We just recruited a brand new chief of genetics from Cincinnati Children's Hospital, who's bringing some really exciting things here in terms of genetic treatments and diagnoses. And of course, our level 4 NICU being the highest level in the region, managing babies that are as young as 23 weeks gestation with some outstanding outcomes, both from a lung perspective, from a growth perspective, and a neurologic perspective. So we offer a full spectrum. And the other thing is, as we all know, we are the only region's level 1 pediatric trauma center. So we are here with all the surgical subspecialties and the critical care that's needed in case your child suffers a catastrophic injury. Well, as you may know, many healthcare organizations, and children's in particular, are financially really strapped, especially because of the pandemic, but in general. And so every dollar that you send goes directly to kids. In particular, we take care of many kids with significant complex healthcare needs that have so many challenges in their daily life. And our goal is to make sure that we can maximize their abilities and maximize their quality of life. And as I said, every single dollar will go to help that.